ambulance has arrived.
He has a severe pain in his stomach. He needs an immediate treatment.
We need to move to the nearest hospital for his treatment.
We have reached to a hospital. Let's take him to emergency ward.
He went for dinner, and while having food, he has severe ache in his stomach. Let's help him out by getting it out from his stomach. Let's begin the surgery by taking X-ray of patient's belly. Drag the red cross toward the mark X. Well done! We can see the object inside the patient's stomach. Intubate the patient to ensure take the throat opener and insert into patient's throat. Good! Now take intubation tube and insert it into the patient's throat. Carefully remove the throat opener from the patient's throat. Connect the intubation tube. Turn on the lung pump. Take a marker and draw a line. Use the scalpel for the incision. Take Bovie tool and burn the vein shut to stop the bleeding. Use the clamps to move the skin and flesh out. Take scalpel and make an incision so we can remove the object from the patient's belly. Take the camera, insert it into the patient's stomach. Good! Now we can see what's... Now, carefully insert tongs into incision and remove the object. Use the needle and thread to stitch the stomach's cut. Take the needle. Turn off the lung pump. Disconnect the air tube. Now lastly, remove the intubation tube. Congratulations, you did a great surgery.
Call 911.
Clean the blood with the cotton. Apply some ice on knee. Apply the ointment on it. Tie the bandage on the wound. Ambulance has arrived.
His knee is badly injured. I think it needs a surgery. We need to take him to hospital as quickly as possible.
We have reached to a hospital. Let's take him to emergency ward.
Hello, I am Dr. John. I'm here to guide you throughout the procedure of knee surgery. Let's check the vital signs before the surgery. Without checking this out, we cannot proceed. Apply the betadine solution on the entire surgical field so that the patient's leg is bacteria-free. Soak the sponge into betadine solution and apply it on the leg. This will reduce the chances of any type bacterial infection. Draw the outline with the help of marker on the patient's knee. With the help of marker, draw the incision line. Take the scalpel to make a cut on the marked area. Use the bovie to cauterize the bleeding veins to reduce the blood flow in the surgical field. For the surgery, patient's knee should be elevated. Patient's leg is in proper angle. Take the wronger and then tap on the meniscus and each of the 4 bone spurs to reshape the bone. Now use the drill and make a hole into femur. Put the jig into its position and also the alignment device. Use the mallet and insert the jig pins so that the jig is firmly placed. Remove the alignment device. Use the bone saw to cut the bone. Take another cutting jig. Along with the bone saw allows us to finish shaping femur. The tibia cutting jig is aligned with the big toe and the highest point of the tibia. This will make sure that the leg is properly aligned even after this. Now use the bone saw to shape the highest point of tibia. Use the bone saw to cut the patella. Take the plastic spacer and insert into metal tray component. Now take the metal tray component to attach it to tibia bone. First, attach the femoral component on the feet, and now take patellar component and attach it on the patella. Take the cement and spread it on the surface of femur bone. Check the range of motion of the patient's leg. Hold the foot handle and drag the leg left slowly so that components are properly bonded with the cement. Wait for 10 to 15 minutes so the cement can dry properly. Now it's time to stitch up the fat layers. Use the stapler or suture to close up the incision. This can't be your first knee surgery, is this?
Call 911.